Usually when people talk about diving, you automatically think wetsuits and water. But when patients take a dive at Community Regional Medical Center's Hyperbaric Oxygen Therapy Unit, it's all about healing in a pressurized chamber. Community Regional has the first and only board-certified staff for hyperbarics, and its specialized team gives patients the highest level of care. Here's how going under pressure helped a Valley woman heal when it came to her surgeries and wound therapy.
In 1998, I was rollerblading at a roller skating rink, and I face planted and knocked out 3 teeth. In an effort to save those teeth, multiple surgeries was done by my oral surgeon. And during all those procedures, there was a lot of noticeable damage to the jawline and loss of blood flow to the area, so my gums started receding.
Over the years, Chandra, an ER nurse, went through many surgeries and procedures, but still had problems.
And in order to save that area, my oral surgeon grafted an area of skin from my palate, from the roof of my mouth, in other words, to the front of my mouth in order to cosmetically save the area. Anytime they do a skin graft, HBO is recommended to increase the blood flow to the area to increase healing. Increases the chances of the success of the graft.
Community Regional's John Kampschmidt is the only board-certified HBO therapist in the Valley. He explains HBO.
HBO stands for Hyperbaric Oxygen, and we call it therapy. And that is 100% oxygen under pressure.
John says the air we breathe contains 21% oxygen versus 100% oxygen in the hyperbaric oxygen chamber. By pressurizing the oxygen in the chamber, we are able to deliver 2 to 3 times the normal amount of oxygen to the body.
We treat people from anywhere from 1.5 to 3 atmospheres of pressure, which is equivalent of about 66 feet of seawater at depth.
Hyperbaric oxygen can be used to provide you with one or more of the following effects. Increases oxygen delivery to the injured tissue, stimulates new blood vessel formation, advances wound healing, improves infection control, preserves damaged tissues, eliminates toxic substances, reduces effects from toxic substances, reduces or eliminates tissue obstruction by gas bubbles.
I drive to Fresno, even if it is an hour and a half both ways. It is a higher level of care for me. It's either that or, you consider the alternative of, you risk losing your graft. And I've been through enough and I don't want to do that again, so I'm willing to make that sacrifice. The treatment in the chamber lasts for about 2 hours, and that includes start to finish. They do your vital signs and check your blood sugar, get you ready to go, and once they get you started, it takes 2 hours.
At this appointment, Narissa Arredondo monitors Chandra.
If there's a patient in the chamber, there is a clinician that is certified to do hyperbarics in the room at all times with you. For the most part, patients kind of feel comfortable and relaxed in there, and a lot of them actually take naps in there.
You ready? Okay.
I'm comfortable. They can adjust the airflow so it can be warmer or cooler based on your body temperature.
Chandra gets the benefit of having a whole team look after her.
Community Regional Medical Center has 4 wound specialists on staff in the burn center. And so that provides a comprehensive team to help manage complex wounds.
Oh, the staff here are amazing, and they tease me a lot because I'm one of their most conscious patients.
John and the team are trained to provide care at the highest level.
There's an expectation within the community that as a teaching facility, as a teaching hospital, that we have higher standards. And I can tell you from personal experience that we strive to meet those high standards. And I wouldn't hesitate to send one of my family members to the burn center and to be treated there. And that's where I'd want them to go.
Along with high standards comes individual care.
We are all very compassionate. We want to help them heal. We're constantly looking at new ways to heal their wounds.
Chandra's glad to have this team and technology to help her.
This facility is phenomenal. Being a healthcare worker, you get to see, the cool equipment that they have and just the resources that they have. I hope that I don't have to have any more surgeries. I hope that the effects of hyperbarics are such that my graft is successful this time, because this is my second attempt at a graft.
Chandra is excited about her progress so far.
After the graft heals, then they go back in and they attach the teeth to the posts that are already in my jaw. So essentially they're just hoping for the gum graft to take its place.
And with all her treatments, Chandra is hopeful.
So hopefully it'll be a success this time.
It's a good thing being under pressure is helping Chandra heal. If you think HBO therapy can help you, make sure you ask your doctor about it. But remember, you must be referred by a doctor, so check with your primary care physician. Again, if you think you might benefit from hyperbaric oxygen therapy, ask your physician for a referral to Community Medical Center's Hyperbaric Oxygen Therapy Department. If you'd like more information about this treatment, you can call them at 559-459-4486. And if that information went by too quickly, you can always visit our website. It's medwatchtoday.com.